Okay, so today we went to Angus's infectious disease doctor. It's 11:19 on Monday, June 22nd. Okay, so we get out of there. He ran a blood test. Now, we went to infectious disease with a positive throat culture with Stachybotrys, right? Stachybotrys is toxic black mold. We have found toxic black mold. He has a positive throat culture for black mold in his throat. So he didn't want to see him without a positive blood test. So he did 2 tests. He did a test for aspergillus, which is not Stachybotrys, and no, that test does not detect Stachybotrys. And he did another blood test, beta-D-glucan, which also does not test for Stachybotrys. There's no blood work that will test for toxic black mold in your blood. So he got pissed off because I was asking him questions like, what tests do you suggest that he do so that, as per his symptoms, so we can make sure this isn't a fungal infection? And he got pissed off and said, am I treating you or am I treating him? And then he started shaking. He was so angry. A whole house gets infected with black mold, not just the fucking patient, the one person you're seeing. And also, I'm his medical proxy. So I'm the one that handles making sure that he gets what he needs said and he gets what he needs told to him. So the communication lines go through so that, because he has memory issues, because he's sick, because we're sick, because we have fucking black mold in our house. And this asshole got angry. I don't think it's a fungal infection. Well, yeah, because none of your tests tested for the fucking fungus that he has a positive test for. So that wouldn't give you a positive test for a fungal infection, would it? And I asked him, what test does he suggest? He would not answer. And then he got pissed off and he said, I don't think you have a fungal infection. Go see a neurologist. Get a sleep study. So, there we go. Physician Dr. Munir P. Shah, SHAH, MD, at the St. Elizabeth's, Youngstown. This is Mercy, No, that's where he got the test done. Yeah, he works at a fucking podiatrist office in Austintown. Or are we in Youngstown? East Market Street. This is fucking ridiculous now. This is what I mean about it's like weaponized ignorance. Malicious weaponized ignorance. He got offended because the medical proxy of the person who he was seeing had questions and concerns, because I've been dealing with it for 9 years. I'm having to go get cut open to get tests so that they can be done, so that we can have positive tests, because these assholes don't know what candida tongue is. And he got upset. The word no graced my lips because he thought that he was going to bust in and say, no, candida is in your mouth. There's no candida tongue. They don't know the clinical presentations of fungals. So what the fuck? Continuing on this entire fucking tirade of how the ignorance in a very highly fungal state is creating mortality rates. I just got done reading this morning about testing, and it was from Medline, and it was about the pathology of testing for fungal infections and how it's difficult, because my CT scan came back and it was a shit show. I have abscesses on my kidneys. I have bulging veins in my abdomen. I have all kinds of fucking problems in my insides. Voids. Yeah, because funguses start growing and they create growth areas. And in it, it said, if you think that there is a fungal infection, treat for it. because it is fucking hard to get positive testing. There's too many false negatives, false positives, and like this shit. And it says on here for the beta-D-glucan that they have false positive because of medications, and they have false negatives because of medications, and it's just not reliable. So now we get to go on our way, and he gets to continue being sick. And he had Dr. Shaw had the audacity to say that if you remove the fungal out of the home, if you treat the black mold, then your infection will just go away. It'll just go away. Is this what America thinks? Is this how American doctors believe, that your fucking infection will just go away? Unfucking believable. And I told him that I have candida symptoms and he has Stachybotrys symptoms. And why is he doing tests that don't look for Stachybotrys? Why? Questions. More and more questions. So if you're having fatigue and muscle pain and swollen lymph nodes and gastric issues and swollen belly, and you can't get a hard bowel movement to save your fucking life, and your uterus is swollen, and your pancreas and your liver are swollen and scarred up, and you have all these fucking symptoms, just fucking go die, because they're not going to find it. They do not give a shit even enough to test for the fucking fungus that you tested positive for. And that's infectious disease, who hoards the anti-fucking fungal medication that will save your life. Good luck out there. Stay healthy. I'm going to go have some fucking breakfast because I can't fucking take any more today.